Hello, friends. Myself, Dr. Prashant Brother, and this is our first live session. I hope the audio quality is good, and I'm not familiar with this setup, but I'll try my best. So, today we'll talk about osteoarthritis. So, basically, osteoarthritis is a swelling of the joints. So, this is because of various reasons. So there can be multiple reasons for the osteoarthritis. So in this, the joint cartilage degenerates, and because of that, the protective as the protection of the joint, that is the cartilage has gone. So the, the contact between the bone, joint bone, that causes the pain. So I'm telling in crude language. It's not a scientific or a medical term. This is for the general public. So I'll show here. So if you see, this is a knee joint. Okay. So this is a thigh bone, and this is a leg bone tibia. So and if you see here, these two bones are not in direct contact with each other. So here one more is cartilage is there. That is, we call it a menisci. And at the ends of the bone are covered with the cartilage. So there is a double protection here in the knee joint. So what happens in the osteoarthritis? What happens in the osteoarthritis? The protection is gone. So the bones rub with each other now. So there are multiple reasons for this osteoarthritis. And patient, what the initial complaints will have patient is uh, pain and stiffness in the morning, and swelling around the joint, and there can be decreased movements. Okay, patient is not able to hold or use the joint. And in the later stages, in the advanced stages, you can get a bony enlargements around the joints. Okay, so we call it an osteophytes. What are the common causes of the osteoarthritis? Okay, so first is age related. As we age, the cartilage goes on degenerating. So, elderly patient will have a more common osteoarthritis. Then the obesity. If the patient is obese, especially uh, BMI is more, then as the more load is put on the knees over the years, the degeneration starts early. One more thing is female sex. In a female, you have a degeneration early, as because of low bone mass density and more prevalence of osteoporosis. So you get a early osteoarthritis in female. One more reason is use how you are using your joints. If you are overusing it, or you have any trauma in the joint, so then also there are chances the patient will get a early osteoarthritis. And especially some sports persons who are putting up repetitive stress on the joint, so they can get a osteoarthritis in early life. So, what are the main common joints which are getting affected with osteoarthritis? The most common is the knee joint. So, after the knee, the hip joints are also seen, but most of the time you get a knee joint osteoarthritis, followed by spine and hands. Elbow and wrist, these are rarely get uh, affected because these are not weight bearing joints. So most of the time you will get a knee and hip joint. So how we have to prevent this osteoarthritis? So most of the time the age is around 70, 80. That time that is a natural progression of the trends towards the osteoarthritis. But if you are getting in 40s, 50s, it's not a natural progression. So in this case, how you will prevent it? First is control your weight. So I hope you are getting my audio clearly, audio and video. If something is problem is there, please let me know. Okay, so how to prevent it? First is control your weight. So overweight causes osteoarthritis. So you have to control your weight. If you are overweight, reduce your weight. And the method is uh, control your diet. Okay, so don't eat sugar, sweet, restrict your oil intake and rice intake because these are high glycemic foods. And low impact exercises. That is very important. Low impact. So don't put a impact on your joint. So low impact exercises for the weight reduction. And normal regular exercises, quadricep strengthening exercises, that will also help the help to maintain jointing uh, to prevent or delay the osteoarthritic changes. And when you're having pain, uh, you can visit a orthopedician. He'll guide you and with some medication like some supplementation, chondroitin sulfate. So that will help in maintaining the joint. So some intra-articular injections, especially the hyaluronic acid, we give it in stage 2 or 3 stage of osteoarthritis. But generally we avoid giving intra-articular injections. So the best way is control your weight, do regular exercise, strengthen your quadriceps muscle, control your weight. So these are few tips from you. So I think I'm not sure how the audio and video quality is there. So this was my first live session. Whatever problems are there, whatever complaints are there, whatever doubts are there, you can mention in the comment box. I'll try to address it. And please try to uh, guide me through these live sessions because I'm new to it. I'm not that tech savvy, but I'm trying my best. Okay, so please subscribe to the channel and hit the like buttons if you like. And next live we'll be doing as soon as possible in near future. But please mention the topics so that I can talk on those topics in the next session. So thank you.